You're listening to Vet Candy.
Yeah, so I was feeling pretty good about myself, right? I'm like, okay, we figured out some things. We've given her some peace of mind. And then July comes. It's a really hot day. The owner calls and she says, Jazz is in a respiratory distress episode.
Welcome to the Vet Mysteries Podcast. My name is Dr. Jill Lopez. This podcast is powered by Vet Candy, a multimedia platform offering diverse veterinary content produced by veterinary experts and key opinion leaders. In this podcast, we unravel some of the most baffling and fascinating cases in veterinary medicine. Please let us know how you feel about these cases. You can find us on social at MyVetCandy. Now, let's get started. I'm so excited to have on our show today Dr. Jean-Yin Tan. Welcome to the show, Dr. Jean-Yin.
Thank you so much, Dr. Lopez. It's really nice to meet you.
I am so excited to have you on the show. I don't think we've had maybe one podcast show about horses, but we definitely haven't had any mystery case about horses. And I love horses, but I don't feel like I'm worthy of working on horses. But I'm so excited to talk to them today. So you're a horse vet, huh? Did you always wanted to be a horse vet?
I did. Ever since I was very young, I fell in love with horses. I started riding, and that's the reason why I went into veterinary medicine.
Oh, really? What kind of riding did you do?
Pleasure, little hunter jumper, nothing really, really competitive.
So did you have a horse when you were a little girl?
I did not. It's quite expensive. It's an expensive sport. And so I always rode other people's horses. Yeah. So lesson horses at first, and then whoever's horse was at the barn.
Oh, okay. Okay. Where did you grow up? Did you grow up in Canada?
Mostly in Canada. So I spent like 11 years or so in Edmonton, which is north of where I am now.
Okay. Okay. So a lot of people have horses in that area. And I mean, same thing with me is like, I grew up in West Virginia and we could never have afforded a horse. And they weren't even that, compared to now, I was just talking to someone from Alaska and they're paying $25 for a bale of hay in Alaska. I mean, it wasn't that expensive, but we didn't have a place to put them. But my neighbors had a horse and I'd always sneak over and ride the horse. So it does seem like there's a lot of girls that grew up loving horses and they go into veterinary medicine. And then another strange thing is I know so many people, not me, because I knew I could never be a horse vet, but a lot of people go to vet school and they want to be a horse vet. Once they do rotation, they change their mind and they go into small animal. Have you noticed that too?
I have, unfortunately. Yeah, we do lose quite a few people who are interested in horses when they go into vet school, and they kind of realize it's a little bit of a tough life out there. So unfortunately, we lose quite a few to small animal, but they still keep up their love for horses. They have time to ride and enjoy horses still.
There's a group I belong to on Facebook. I think it's called Deviant Mom Equestrian or something. So it's people that most of them are not horse vets, but they're taking riding lessons and stuff. And a lot of them are just, buying their horse. They haven't ever had a chance to buy a horse. So now they're buying it. So it's fun watching their story on there. And then I know someone who was, oh my gosh, like I feel like there's this mass exodus of the people that are horse vets that are leaving the industry. Somebody that I really love, and I could not believe that this person told me last week, she said goodbye horses and now she's in small animal. I'm really surprised. I think it's a little scary right now, right?
It is. Unfortunately, we have like a 40% attrition rate at the 5-year mark in AAEP, so in the American Association of Equine Practitioners. And it's a problem that everybody's aware of and they're working on. So they actually have a really good initiative right now where AAP is looking at the reasons why people are leaving, what they can do about it. I myself am working on some research with Lincoln Memorial University, and we're working on a long-term longitudinal retention study.
So. Okay. Oh, I can't wait to hear. You got to let us know when you find out because I would love to know. I was so surprised that she left the field and she's not looking back. I don't know if you'll ever get her back into equine medicine, but I did know a vet student and she loved horses. She has a Morgan horse and she went to vet school thinking she was going to be a horse vet. And I remember when she went into her rotation, I didn't hear from her. I think it was like 20 weeks, but I think maybe it was like 5 weeks or something. And she came out and she's like, no, No, she loves horses, and she decided that she'll be her own horse vet, but she'll do small animal, but she'll be able to take care of her own. That's her goal. So hopefully something changes, because we need horse vets. We do. There's not a lot of vets in some states anyway, but I was talking to a vet who's in, I think, Minnesota, and she said she's one of like a handful of horse vets in Minnesota, and people will drive 5 hours just to see a horse vet. So hopefully something changes, because we need them. We need them bad. We need them bad.
Absolutely. Yeah. I think it is a growing issue, but at the same time, the people who are still in the profession, they're the diehards, they're dedicated, their love for horses is so strong that they'll go through, the emergency on call through the night. I know for myself, I owned my own clinic for almost 5 years. So it was 24/7 on call. So you've got the really dedicated people who are still in equine medicine. So people have been telling horse owners to be appreciative and to, just show their love for their veterinarians as well.
Yeah, do what you can. Don't let them go. What did you do undergrad? Were you like an equine science major?
So I actually went to University of Alberta, so up in Edmonton, back at home, and I did 3 years of a pre-vet program in animal science before I went over to Cornell for vet school.
Okay, then you went to Cornell. So you went to the United States. Was that the first time you've been to the United States when you went to vet school? Was it a culture shock? I'm just kidding. Because, I feel like Cornell's practically Canada, right? When you get up there, it's so cold, and so, it's so close to the Canadian border too. So what did you think about vet school? Did you love it?
I did love vet school. It's funny because Edmonton is one of the most northernmost cities that actually has a population in it. So it's quite cold there. And it's funny because I moved to Ithaca, where Cornell is, and everybody was constantly making jokes at the beginning, like especially during orientation. They were like, oh, you better be careful. It's going to get really cold here. And they're like warning everybody in the admitting class about the temperature. And I was like,
did you come to school in like January in shorts?
That is a very Canadian thing to do for sure. The funny thing though is it's dry cold in Alberta, and that humidity in Ithaca and where you're from in Connecticut, like it's humid and it's a different kind of cold. Like you feel it in your bones.
So that's funny. So you came down there and you're like, wow, this is it's so hot down here. So were there a lot of people that wanted to be horse vets, like that you were with, and all your friends were horse vets?
No, not really at all. So same as right now, there's not that many people who want to go into equine medicine, right? Or there's more that start off and then they kind of fall out towards the end of vet school or beyond. So there were probably 8 of us out of a class of 85 or so that were interested in horses. And there's only a couple of us left practicing in horses. So, we lost some to injury, we lost some to lifestyle, and there's still a few still practicing mixed animal, one in private practice with equine, and then a couple of us in academics.
Okay. Well, good. And if there's anything we can do to help promote people to go into horse medicine, to know it's okay, you can come back, it's fun. You can be your own boss, you can do your own hours. You don't have to do emergencies. You could do preventative care.
It's actually an incredible lifestyle to be invited onto people's property because, when you're a small animal veterinarian, everybody comes to you. But I feel like in large animals, really unique, where people have to actively invite you to come. And it's quite an honor, really, to see horses in their natural habitat, spend your time outside. And we have such diversity in cases. Like I always tell people right now, one day I'll be out in an Indigenous reserve seeing horses who are underserved. And then the next day I'll be at Spruce Meadows seeing a $5 million horse. And so it's really cool diversity of clientele and diversity of patients that we get to treat. No matter what, to me, a horse is a horse and they all deserve medical care.
Yeah, exactly. And now you surely have horses now, right?
I do not. It's too expensive.
Oh, but now you can say, I should probably take it out on a trail ride and see how it's doing. And then you could ride whatever you want, right?
Yeah, definitely. Yeah, there's a lot of trail riding outfits here. We're very close to Banff. We're an hour from Banff.
Oh, wow. I was supposed to go there once, but something came up and I had to cancel my plans. But I was so excited to go there. I've heard how beautiful it is.
It's beautiful. Come visit.
people need you because you're one of the only horse vets. So part of your payment could be is you get to be able to ride their horses whenever you want. You have all the power.
Definitely some trading could happen. Yeah.
If you could get, like, what would be your dream horse? Like, if you could get a dream horse, what would it be? Like, out of all the different horses, which would it be? And what color would it be?
Other veterinarians will laugh at me, but I love the Arabian horse. I like that. I absolutely love them. Yeah. And I grew up reading King of the Wind, the Black Stallion. So 100% want an Arabian.
And would it be a black Arabian?
Probably. I don't even know if I've met a black Arabian. I see a lot of grays and chestnuts and some bays, but I don't even know if I've met a black one.
They're so beautiful. Like, if there was a beauty contest and you have an Arabian in there, no one's going to have a chance, right? There's no horse
Exactly.
that they could beat an Arabian in a beauty contest.
And they're smart and tough as nails.
Yeah. So that's cool. And I did read The Black Stallion. I remember when the movie came out. That was such a good book. That was such a beautiful horse, too.
Yeah, such a beautiful series. And those books, I'm going to have to write them down, the ones that you mentioned. I haven't heard of them, but they sound really
I don't know how I even found them out when I was a kid. And there was one called Horse for XYZ. Someone was at like a summer camp and she had, I don't know, but these books are so good. And so I'm like forcing my daughter. I'm like, you have to read this book. And then to get her to read it, I always try to read it and she goes crazy. Because she's scared I'm going to lose her place. But they're such good books, but they're not like mainstream books. And I have no idea how I found out about them. But I did read the mainstream ones. But we need more horse books out there. Maybe that would make more horse vets.
Exactly. Maybe you're making your daughter into the next horse vet.
Yes, I know. Yeah. It's like a tween. It's like not when you're a teenager. It's like like when you're 8 to 10, you have to read these books and it makes you want to be a horse vet. Yeah, and each one, something happens to the horse and they have to take care of the horse. Like this summer pony burns her legs and they have to put salve all over her legs. And it's like, I think that's part of why we get into the field is we want to be a healer. So those things make you want to do that. So that's what you guys got to do, equine practitioners. You got to start writing tween novels and make them popular. So I'm so excited to have you on this show. And remember, I know a little bit about horses, but I don't know a lot. But you have a really cool case we're going to talk about. And let's go to break right now. When we come back, we're going to get into the mystery.
We'll be right back with more Vet Candy.
Are you ready to unmask the opioid crisis and uncover the vital role of veterinarians in the battle against it? Join me, Clay Palmer, for Unmasking the Opioid Crisis, a veterinarian's vital role unveiled, presented by Vet Candy and brought to you by Covetrus. In this enlightening podcast series, I will take you on a journey through the layers of the opioid crisis and talk about the role veterinarians play to help protect their patients, communities, and even themselves. Together, we'll unravel the complexities, engage in insightful discussions, and gain valuable insights. Stay tuned for a podcast that empowers, educates, and unites us in the battle against opioid misuse. Don't miss Unmasking the Opioid Crisis. Tune in on Vet Candy on a podcast platform of your choice, and let's make a difference together. Brought to you by Covetrus and presented by Vet Candy.
So I'm so excited, you guys. We have a really great story today. This is a real story, right, Dr. Jean-Yin?
Absolutely. It's a real life story.
So take us there. So take us that day. Like, was it a cold, snowy day in Alberta? What was it like? Like, bring us to that day.
Yes. So it was actually summer. It was beautiful out. This is when I practiced in upstate New York. I wanted to give you a nice case where I'm there with the horse from beginning to end. So it's a beautiful day outside, it's summer, and I'm seeing a horse named Jazz. He is a 17-year-old quarter horse chestnut gelding, and he's a pleasure horse used for trail riding.
So great. So the horse owners called you up and said, his name was Jake, you said? Jazz. So the horse owner called up and said, Jazz ain't doing right. What did they say? What was wrong? What did they think was wrong?
So they said they needed a second opinion. So Jazz had this cough on and off for about a year. So chronic cough. And then occasionally he'd get these like his nostrils would really flare up and he'd, show more trouble breathing. And he'd been seen by another vet over the last year and he'd been treated with all sorts of things. So dexamethasone tablets, albuterol tablets, sulfa antibiotics, penicillin, ventapulmin. So he's been treated with everything.
Nothing made him better? Nothing made him worse?
The funny thing is he isn't really consistent. And so he has these coughs occasionally. The meds make him better for a little bit. And then he'll have these breakthrough episodes where twice in the last year, he's had these big episodes of respiratory distress where the owner got really scared.
That he was going to die?
Yeah, like he just had a lot of trouble breathing, like making a lot of noise when he was breathing, really struggling. And then she would call the vet on emergency. So they'd come out and they'd give her another round of one of these drugs. And, she loves Jazz so much. And she just wants the best for him. So she wants to, get rid of this issue that's causing these episodes.
Like, was he inside? Was he like kept in a stable, or was he outside all the time, or what?
That's a really good question. So he was kept outside 24/7 in this beautiful green pasture, but he does have a run-in shed. So he has a shed out there and it's bedded with some shavings. And he's kept outside with two little miniature donkeys.
Oh, it's the donkeys. The donkeys. He's allergic to donkeys. It would be so easy. So now when he had problems, was it because were they riding him? Was he exerting himself when he had the problems, or was he just out in the fresh air having problems?
Yeah, so they ride him about once a week or so whenever the group of friends gets together and they trail ride together. One of the episodes was totally unrelated, and the other episode was a day or two after riding. So not really while he's being ridden.
Okay. So he had almost like a normal life except for these episodes?
Yeah, mostly a normal life, just this chronic cough, like underlying cough. And then he had those two episodes.
And it's funny, like when you're riding horses, when they cough, it's like the whole body shakes too. So when they're coughing. So did he have anything? I know back in school, you could see if with a chronic cough, sometimes there's like an exertion where the muscles, you could see the line of the muscles. Was he that bad?
The heave line is what you're talking about, I think.
Yeah, the heave line. That's it.
The heave line is a fun thing. So it's actually when horses really have a chronic cough and their muscle actually hypertrophies. So their external abdominal oblique hypertrophies because it's used so much.
I think I have that. I finally had a 6-pack after influenza A because I just coughed the whole time. Did he have a heave line?
He did not have a heave line, fortunately. Yeah.
Because it was sporadic. It wasn't continuous, right?
Exactly. Sporadic, not continuous, yeah.
And so you would see the heave line if it was COPD.
Mainly is symptomatic. So it mainly indicates that a horse is coughing a lot chronically. So it's kind of like if we did sit-ups every day, maybe we would eventually get a 6-pack. Maybe some of us. I don't know. I don't have one.
So, okay. So he didn't have that. And it's so very sporadic. It wasn't just because he was stimulated, he would have it. It was a beautiful summer. He's outside, breathing the fresh air. Like, I wouldn't know what to do. I would have to call a specialist at that point. So what did you do?
Yeah, so I asked a little bit more about the history, just like you did. And then I found out what kind of food he was on.
Oh, yeah, food and water. Did you check his food and water and his hay?
I did. So he was kept on a grain called Nutrina Prime, which is a very good food for adult horses. And then he was on free choice hay, so just regular grassy hay. And she would soak it for like 5 to 10 minutes before feeding. So she was worried about any sort of allergens from it that would make the cough. Yeah.
Because he was coughing when he had dry hay, but then he was also coughing when he had wet hay.
Yeah, he was kind of coughing either way.
It didn't help at all.
It didn't seem to, although when I saw him, he was actually pretty normal. So maybe it did help. So all we see as veterinarians, right, are one point in time. And other than that, we rely on the owners to tell us, which this owner was very in tune with her horse. So she was great. So when I went out there, he really looked normal, like his temperature, heart rate, respiratory rate, all that was normal. Body condition was slightly excessive, 6 out of 9. But like you said, he had no heave line. He was breathing normally.
So you're saying he
Everything
was
seemed
a little chubbier than he should be?
little chubbier than he should be. You know, that lush green grass.
Yes, yes. Isn't it funny? Like, how can something get heavy on grass? Like, it's like, so I guess you could get heavy if you just ate salad all the time, you could be heavy. I guess it depends on what toppings you put on it. But
Yeah, right. There's a lot of sugars in grasses, actually, especially that lush green grasses out in upstate New York. If you think about like a horse's natural habitat, normally they're scrounging around, right? Like there's shrubbery, there's a lot of dirt and rocks and stuff, and they have to look for nice grass. Whereas we keep them on beautiful, manicured, grassy pastures. So that's not really normal.
and they don't have to look for it. It's just brought to them. So he had good water. His food was good. The hay looked good. Did she happen to videotape any of the episodes where you could see what he was doing?
She did not, unfortunately. That has been such a wonderful technology that I didn't have when I first started practicing. We didn't have smartphones back then. Back in the day, we even had to develop all our own x-rays in the darkroom.
I
And
remember
so
that. Yeah.
so much better now. But yeah, she was a little bit of an older client, so she did not have any video.
You know, your career, like with horses, you could actually do a lot with telemedicine, right? Because the horse, you can see the horse in its natural environment. It's not stressed because someone's there. But I guess going to a farm, it's like when you have in small animal practice, you'll have a dog who has been limping for 6 months. He comes in and walks right through the door because he's so freaked out. And I guess maybe the same thing with horses. You were there, and if she thinks there's something wrong with me, I'm going to be turned into dog food or something. You know, I mean, horse, you never know what horses are thinking. So he was on his best behavior.
That is a neat difference between small animal and equine practice, I think. As you said, those small animals, they're so excited because they're totally out of their routine, right? Like, no, they're used to probably sleeping at home all day. And instead, you like jam them into a car, bring them to this weird place with all these small animals. So the beautiful thing about this is I get to go see this horse in his natural habitat with his donkey friends out in pasture. He's not too stressed, actually. He's pretty happy. I'm seeing him in his natural state.
Oh, good, good. So what did you do? I mean, what were you thinking? You looked at all the medicine he's been on. You talked to her. You saw what he looked like. What were you thinking?
So you think when you bring your kid to the doctor, right? One of the things, if they have a cold, the doctor's probably going to say, okay, I'm going to listen with this stethoscope and I want you to breathe deeply. I would love to do that to Jazz, right? Like, I'd love to be like, hey, Jazz, I'm going to put this stethoscope on your lungs and I want you to breathe deeply. So I don't know if you remember this from vet school, but we actually put a bag over their nose, which sounds crazy.
It looks crazy. And people probably going crazy, like, oh my gosh, she's coming to torture our horse.
I know. It's this thing where you've been taught since you were a kid, never put a bag over your head.
Yeah, no, don't put a bag over your head. And definitely don't put a bag on your horse's head. When I lived in Illinois, I actually had a horse and we had, they had their fly masks on. Somebody called the police on the place we were keeping them and said that we were putting bags over their heads. The police came out to look at them and stuff. And we're like, it's a fly mask. I bet that happens a lot, but maybe not in, up in Alberta where people are very smart, but down here they did. So you put a bag over his nose?
I put a bag over his nose, makes him rebreathe his CO2 and makes him breathe deeper. So it's called a rebreathing bag exam. So there are 3 things we evaluate during a rebreathing bag exam. One is how quickly it exacerbates their clinical signs. So for example, if the horse is supposed to be a chronic cougher, if I put the bag on, I'm going to see, how quickly does he start coughing? How bad is the coughing? If he has signs of respiratory distress, which she's mentioned before, how quickly does he get worse with the bag on? And then while the bag is on, I listen to the trachea and both sides of his lungs. And I listen for adventitious lung sounds like crackles and wheezes. And then the third thing is I look at how quickly he recovers. Like after I take the bag off, does he take 10 minutes where he's gasping for breath, or does he recover right away?
That's amazing. Like you can learn so much from that bag, the rebreathing bag.
Yeah, us internal medicine specialists, we're like picking for details, right? So we are definitely paying attention to every part of that bag exam. So he did great. Actually, I put the bag on and he didn't cough. He didn't do anything. I listened to his lung sounds. They were normal. His trachea was normal and he recovered really quickly. The only abnormality, as I said, I'm looking for abnormalities because I'm an internist. He had this tiny little bit of unilateral mucoid nasal discharge after the exam, just a little bit.
Okay, so I'm thinking fungus. I don't know why. Is that what you thought too?
I thought it might be a couple of different things. I went back to my problem list, right? Like that's what we tell the students to do. So I'm like, okay, he's a heavy set horse. So he has a body condition score of 6 out of 9. So he's not quite obese yet, but he's getting close. And then he has this history of chronic cough and recurrent episodes of respiratory distress, but he's normal now. And so I'm thinking, okay, I need to go to the drawing board. Like, what algorithm do I use in my head for a cough? And in horses, what I usually do is I think, okay, is this infectious or non-infectious? This is such a large animal thing. Like, infections are common. So is it infectious or non-infectious?
So he had been doing this for over a year, right? So most likely it's non-infectious just because the length of time, right?
Good point. Yeah. If it was infectious, wouldn't he have gotten worse over the last year to the point where he had to be seen, right? He's got a conscientious owner.
Oh, and I forgot to ask you, the donkeys are okay?
Donkeys are fine. They're looking at you, being naughty. So I'm definitely thinking, okay, infectious or non-infectious? He has a normal temperature. It's chronic. None of the other animals are infected. So we're thinking non-infectious, right? And then I go back to my physical exam. Is it upper respiratory or lower respiratory?
So his lungs sounded clear, right?
Mm-hmm.
His trachea sounded fine too. And he had unilateral discharge. The lungs are clear. It's not lower in respiratory disease.
I think this is the point where you're like, my physical exam is too limiting right now. I've got a normal physical exam here. I need a little more to go on. I haven't even heard him cough at this point. Yeah, at this point, I probably don't have enough information on whether it's upper or lower. But what I do know is kind of what's common in horses. So what's common in horses is, you mentioned earlier, you said COPD, right? Is that what you said?
Yeah, COPD. I always think about horses and COPD, but I'm thinking like that's like usually a dusty barn, right? It's a dusty barn. Yeah.
So COPD is kind of an older term called chronic obstructive pulmonary disease, and we actually don't use that term anymore. They used to call it COPD because of the airways being more constricted than normal, and then they realized it actually doesn't correlate with human COPD at all, and so it would kind of mislead people. So they started to call that recurrent airway obstruction, and now they call it equine asthma, which is great.
So formerly known as COPD is now the term is equine asthma. So if you hear someone calling something COPD, you know they're out of style.
A little out of style, yeah.
So is that what you thought maybe he had, was equine asthma?
So I had a couple of differentials. One is equine asthma, and the other, as you pointed out, there's miniature donkeys there. And so one thing, for some reason, I don't know why, this always stuck in my head since vet school, donkeys carry lungworm. I must really like that species name or something. That species name has stuck with me my entire life. So whenever I think donkey, I think Dictyocollis arnfeldi.
Oh, I had to look that one up. I didn't know that they were known for lungworms, but they seem like they would be because they're just like little gnomes, right? They're like always up to no good. But lungworms in upstate New York?
Yeah.
I guess you have the Finger Lakes up there, right? There's still lakes, right?
There are lots of lakes there.
Because the lungworms are transmitted by mollusks, right?
These ones aren't. Horses carry them too. It's just that horses don't carry them all the way through the life cycle, whereas donkeys do. And so donkeys can transmit it to horses because they carry it all the way through.
Oh, okay. Well, I'm glad we're talking about this because there's a big trend now. Mini donkeys are in style. So now you need to know if you have, and they'll get them as a companion animal because it's cheaper to feed a mini donkey than it is to have another horse. So now we can get it out there and people can know to watch out for those little sneaky lungworm infested mini donkeys.
Exactly. They're awfully cute, but they do carry lungworms sometimes.
So where do they pick up the lungworms?
Off of the pasture, I think. And so what we can do is we can run a fecal test. It's a special fecal test, though. So you can't do it if you just do your regular fecal egg float, because this is larvae you're looking for. Yeah, so we actually do this fecal Behrman, which is a special test for larvae.
Do you do it in the clinic or do you have to send it out to Cornell Veterinary Diagnostic Lab?
Yeah, definitely. I sent it out, I think, to Cornell. So I did the fecal Behrman. If that wasn't it, I just kind of defaulted to a historical differential diagnosis of equine asthma. So I sent that off. It came back, no parasites seen. And then I told her, why don't you start soaking the hay longer for 20 minutes? Let's change the bedding that you've got to kind of these big flake shavings because they're less dusty.
Because he was using cedar shavings, right?
The run and shed. Mm-hmm. Yeah. So change to like big flake shavings. And then she trailers him a lot, right? And that's the cool thing. You like start piecing things together because you're there and then you see him next to his trailer and, she tells you about the trail riding experiences and the fun excursions she takes with her friends. And so I realized, okay, he's trailered a lot. What do you do when you trailer? You put a whole big hay net in front of their face. They stick their head in it and then you go in the trailer and the wind blows and all that hay goes into your face.
And if you're asthmatic, that's the worst thing that could happen to you, right?
Right? Yeah, 100%. So I said, don't tie his head when he's trailering, the hay on the floor of the trailer. And then he had a whole ton of meds, right? So I said, okay, here's the dose for Ventapulmin. Here's the dose for dexamethasone if you have any issues. But right now he looks normal. And I left it at that.
I would have never thought of lungworm. That's such a smart thing to think of.
It's just one of those things that stuck in my head.
Did it come back positive?
It was negative. Nothing was seen. Yeah. I left things at that and I thought things would be fine.
She was saying he had some really bad situations, but it looks like you figured out the triggers. Like, so it would be his shed when he's traveling in his trailer and then the hay at home. So you're hitting all those potential problems, right?
Exactly. Yeah. So I was feeling pretty good about myself, right? I'm like, okay, we figured out some things. We've given her some peace of mind. And then July comes. It's a really hot day. The owner calls and she says, Jazz is in a respiratory distress episode.
It was like a really hot, humid day.
Yeah. So she's like, oh, he's done it again. And so I go out there. And by the time I get there, she's given the rescue meds. She's a good owner. She's given exactly what I've told her to do.
So what was the rescue meds that she gave him?
She gave Ventapulmin and dexamethasone.
Okay. So she wasn't giving it to him chronically. She was given those medications as when he needed them. Okay, I got it. Okay.
He was on nothing. And then he had the respiratory distress. And then she gave him the dex and the Ventapulmin.
Had she been trailering him or what triggered him to have that reaction?
No, he was just out in pasture on this hot day.
I wonder how many times it would happen when she didn't happen to notice too, right?
That's true. So I go out there and first thing I notice, his body condition score is now 7 out of 9. He's officially in the obese category now. I weight tape him. He's at 1,239 pounds. So it's like for a quarter horse, 1,200 pounds is a little heavy.
Yeah, unless they have like a really big butt, like a big muscular butt.
Yeah, and now he's got some padding too all around. I do his physical exam again and it's normal. So then what do? I throw the bag over his nose again.
Here she comes with the bag. Here she comes.
Exactly. And thankfully he's so good. I can't imagine. I have to like run around and wrestle a miniature donkey if I had to do it on the donkey. So he had one expiratory wheeze.
Oh.
On rebreathing bag exam. So this time I run blood work. So I run a complete blood count, CBC, a chemistry panel, and a fibrinogen. And that's all normal. It takes me a day to get those results back. And then I tell her, you know what? Every time I see him on physical exam, he's mostly normal. So I think we need to do more. It's a mystery case right now. We don't know exactly what's happening, but we've ruled out lungworm. We're suspicious of equine asthma, but why don't we get some definitive diagnosis right now so we know definitively how to treat him? So I sent him into my own clinic so that I could see him for a video endoscopic bronchoalveolar lavage.
Oh my gosh. Wow. So you brought him back into the clinic?
I said, leave him be right now because he looks okay. It's a hot day. We're not going to trailer him today. So she booked an appointment. We saw him, I think, a couple weeks later.
In the morning before it was really hot, probably?
Yeah, exactly.
No hay in his face in the torture.
Yeah, good call. So I said, trailer him without the hay in front of his face. So I see him for a third time that summer. I put a 3-meter scope up his nose.
And they're sedated for this, right? Please tell me they're sedated. Okay. Because I had that COVID test, and when they really put it up your nose, now, you start thinking about all the animals you've done horrible, like you've stuck things down their throat and up their nose, and you're like, it's fine. Until you get it yourself, you don't realize how painful it is. So he was sedated.
Exactly. I think you're thinking, God, we don't want to lose another equine vet to injury. Drugs are our friend. So yes, I gave him drugs, and I always include, for a BAL, I always include butorphanol. Yeah, so it's an antitussive, and it also, helps with the sedation. It's synergistic with our xylazine and our ditomidine. And so I put the scope in, and I see right away that he doesn't have any discharge coming from his sinus, because I'm like looking at everything, right? I look over at the guttural pouch openings, like, is there any evidence of strangles? Those are clear. Everything's clear coming out of his sinus. So then I go into his trachea, and that's why it's useful to have the tor. But like anything tickling your trachea, like that's going to make you cough like crazy.
Yeah, when I had the flu last week, just breathing would tickle my trachea, and I would just have explosive coughing. So yeah.
I can imagine, yeah. And so we actually put lidocaine down too through the scope.
Oh, like you would with cats. We do that with cats.
Oh, do you? Okay.
Yeah, you do. I don't know if they do it anymore, but we used to before we tube them.
That's right. So same idea. And in the trachea, I actually see grade 1 out of 5 mucus, which means I see little globs of mucus in his trachea. And that's abnormal. You scope a whole lot of horses, and they're not normally like that. And then I drive all the way down into his lungs. And when I drive into his lungs, I look at the bronchial walls, and it looks like normal airway wall thickness. Of course, that's a visual. And then I do the bronchoalveolar lavage. So I put in saline, sterile saline, and I draw it back out. So we basically do a little flush of the lungs. And so,
I hope no one ever does that to me. It just seems like it would be awful. Yeah.
I always think that one day I am going to get that done to me, because as payback for how many times I've done this on horses.
Because it's got to hurt, right? I mean, anytime you get one drop of water in your lungs, it hurts. But you have to do it. And he's got sedation on board.
Exactly. So funny enough, I used to do this. I used to do Heaves research with my mentor. So I get up and do this at 5 a.m. before I went to school and during vet school. Which is why I say, as karma one day, I'll probably have to have a BAL done on myself.
Well, hopefully you don't. So you pulled the fluid back, and did it look weird when you looked at it, or?
No, it looked pretty good. So I sent it in because it's a molecular, basically they need to do a fluid analysis. They need to count the cells. They need to look at the cytology. And it came back 31% neutrophils, 65% macrophages, and 4% small lymphocytes. Yeah, neutrophils are our inflammatory cells, right? So there shouldn't be many of them. Ideally, you should have less than 4% or so. And our definition of Heaves, which is equine asthma recurrent airway obstruction, traditionally known as COPD, is neutrophils greater than 25%. So he was at 31%. So it was a definitive diagnosis of recurrent airway obstruction or asthma. So at this point, I've got my problem list. I know that he's obese. He's got recurrent episodes of respiratory distress, and I have now diagnosed him with recurrent airway obstruction or equine asthma. And so equine asthma is non-infectious and it's lower airway. It's in your lungs, right? It's a non-infectious inflammatory pulmonary disease. And it has a spectrum. And at first, when I saw him, I would have thought that he was a mild case. And that's why we treated him with nothing. I just left him with, emergency drugs. I thought he had the lower end of the spectrum, which is called inflammatory airway disease, because he seemed so normal at rest. And that's the beauty of doing these definitive tests, right? So when I do the BAL, what I can't see on physical exam, what I can't appreciate by looking at him, we can appreciate by looking at the cells inside his lung. So the cells inside his lung say he's got way more severe disease than you think he does.
He's just a stoic quarter horse.
Yeah, he's a quarter horse that's well managed by a really attentive owner, but deep inside, he's still got severe equine asthma. We go over all of the environment again and everything, and we know that he is really well managed. And so what we know now is he probably needs more than management, right? Like he probably needs some medications all the time. Yeah, so we go over again. As we go over the environment, she decides, okay, I'm going to start steaming the hay. So I'm going to go one step further because, she's such a good owner. He loves jazz. So she ends up getting cardboard bedding for him like a cat. She ends up making a hay steamer for him. And so antigen avoidance, right? Number one. So it's like, I always tell owners, it's like having a horse with asthma is kind of like having a child who lives with a father that smokes inside the house. You can't get away from it. Like all those antigens that make you cough, you can't get away from it. They're always there. And so the more you can do about the environment, have to band-aid it constantly with medications that can only work for such a small amount of time. So then we talk about meds because we're like, okay, we've got to do more than just management now. We've got to do meds. So there are two main medications that you use for equine asthma. One is anti-inflammatories. And we all know, right? Like, exactly. Steroids are your biggest anti-inflammatory. And then we've got bronchodilators. So muscarinic antagonists, beta adrenergic agonists. But then he's obese, right? So he's a body condition score of 7 out of 9. So if you think about your steroids, they have a lot of side effects, right? Yeah, so you're thinking, okay, when it comes to steroids, in common among all animals, you cause iatrogenic hyperglycemia, you cause polyuria, polydipsia, muscle wasting, adrenocortical suppression, like immune suppression.
And hunger.
Hunger, make you even bigger. But then the biggest thing with horses, and I don't know if you know this, laminitis. There's a big potential with glucocorticoids to cause laminitis, especially if they're predisposed. So he's obese, body condition score of 7 out of 9. He is automatically predisposed for something called equine metabolic syndrome, which causes laminitis. And so I'm at this point scared of giving him dexamethasone, especially long-term, to treat this. I don't know, you've got this great horse right now, owner loves him, and it's just like prime for causing a sad story of laminitis.
Yeah, because if you don't have good feet and you're a big horse, you're in trouble, right? If your feet aren't working.
Back in the day, people would have been like, well, that's just too bad. We have to give him the dex, right? So the great news is with people, we have those puffers. Yeah, so they're readily available. You can get them at the drugstore. So we can actually use the puffers on horses.
Yeah, the big giant ones. I've seen those.
Yeah, so it's actually the same puffer you use for humans. We just get the higher concentration of them. And there's these devices that actually people have made that cup over the nose. And they're silicone. They're really comfortable. And they don't go over both nostrils. So it's not like that whole rebreathing bag situation. It just cups over one nose. And then it's got a little chamber and it connects to the puffer. And then they have a little flap on it that allows you to see when the horse breathes in and breathes out. So you actually then put the puff in when they breathe in, and you can treat them just like you treat asthma in a human.
Oh, that's great. And then with the inhalant of the steroids, you don't have the adverse effects that you do when it's systemically given. So that's great. And it's going to be right there where you need it. It doesn't have to go through the body first and get there, which I love that too.
Exactly. Yeah. So they found in a lot of studies that is extremely effective. And in fact, when they do the whole meta-analysis of data, they've shown that inhaled is actually often superior to the systemic. Like you said, it goes directly into the lung where you need it. You don't get systemic absorption, so you decrease all of the adrenocortical effects. And the only thing is, if you have a really, really bad case that has scarring, they've had so much chronic issue within their lungs. Sometimes the inhalants can't get all the way into the lungs. But other than that, it can be really good. So we decided to do that. We've got a dedicated owner. We put him on beclomethasone inhalant, which is a steroid inhalant, and albuterol inhalant. We gave via an inhalant device called the Aerohippus. And then we basically put him on 5 puffs of that steroid every other day for the entire summer.
I know with cats, like you have to train a cat to get a puffer, and it takes a few days. Do you have to train a horse? I feel like a horse will do it, right? You just give them, especially that horse, you give him a carrot and probably do it, right?
Yeah, I used to use, so there are some other nebulization devices that cover the entire muzzle, and those I had to train them. Like I would have to put like some molasses in and stuff, but this one just cups over one nostril, so you usually tolerate it really well. And then they start to realize that it helps them.
Yeah, then they come to you. They want it to, yeah.
Yeah, so he did really great on it. And the beauty of this is, I'm scared of Dex. The most I'm going to give Dex is maybe for a week or so if it's systemic dexamethasone. And so in this case, we could stop all those respiratory distress episodes by putting him on a small amount all the time. Yeah, so he was just treated through the summer, and then I rechecked him before the winter, and then we put him on every 3 days, puffers instead of every 2 days during the winter. So it was, really, really great for him. He went back to full exercise.
Was he able to get his sexy body back?
I wouldn't say that he got his sexy body fully back, but he went to a 6 out of 9, which is pretty good. Like, it's not bad, right? Yeah. And so I had over 3 years of follow-up on him, and he was doing great.
That's amazing. What about you said he had a unilateral discharge. Like, that was just a red herring? Like, what was that?
So they accumulate a lot of mucus in their airways from the inflammation from heaves. And we saw that when we scoped him. And so I think what happened is just, it didn't come out symmetrically. After I did the stressor of the bag, just a little bit came out of one nostril.
Okay. She would use the inhaler every other day in the summer. She would do one with the albuterol and then one with the steroid. And then as you got, when it wasn't so hot, you would move into every 3 days, like in the winter. So did he have any problem in the winter at all, or he still had to be on the medication?
Yeah, it's funny. So because he's an outdoor horse, he kind of has the reverse presentation of normal heaves horses. So normal heaves horses, because they stay indoors all the time, is more dusty in the winter because you close it up. So they actually get worse in the winter. For him, he was triggered. It was called summer pasture associated heaves, where he was triggered by the heat and the humidity and the pollens and everything else outside. So he did do better in the winter. So yeah, I think eventually we did stop his meds for some time during the winter and then start up again during the spring.
And then she was steaming his hay. She was still steaming his. Wow, what an owner. That's so nice. Like, I don't think I would steam. I mean, I guess I would. I would probably steam my goats' hay if they were allergic. I probably would.
Let's face it, we would do anything for our animals.
For my goats. Now, my sheep, I always trash my sheep on podcasts. Like, they're no good. They're no good. But my goats, I definitely would. Because I feed them grapes. They love grapes, like their favorite thing. I chill them. They don't just love grapes. They like chilled grapes. Goats are amazing. Goats are not mini donkeys. They don't have that edge. They're really sweet.
I think they're so naughty, those goats.
Yeah, they're so cool. I love goats, but I wish we had a horse, but where we live it's so rocky. We have pigs and the pigs tear holes everywhere, and I'm just thinking if we had a horse here, it's just like the rocks or the holes from the pigs, it would just be a mess. But
maybe this is your sign to get a miniature donkey.
Miniature, no. But I was tempted because I did hear that they're really good at like predator control.
Yeah, donkeys are fierce when they want to be.
Yeah, I mean they'll take out a bear, they'll take out wolves and stuff and coyotes and yeah, other than the lungworm. I'm just kidding. Man, that is a great story. And he's a case where, I mean, it almost looks like, what do you do? It looks like it's just this random thing. He's in a beautiful sunny day and you don't realize how bad it is until you go further with the diagnostics.
It's true. Yeah, exactly. That was a good lesson, I think. Going further in diagnostics and having kind of that baseline medication for him was what did the trick.
Yeah. Oh, that's great. He turned out really well, went back and was his trail riding and stuff and had his hay on the ground instead of right in his face. But that's so smart to even think about that. Like when you're working with equines, you really have to be like a private investigator. You have to look around. And I know that with like large animals and too, like, I used to work in a poison control center, and before I came, it was most of the poison cases they had were like on cattle, and they would send this team out to investigate a long time ago, like before it became popular for dogs to poison themselves all the time. And so they would send this team out, and they would take samples of the food, and they would take samples of the water and samples of the hay, and just like look around and it, like I always heard these stories, like they would tell us these stories. So you guys are still living that when you're working with large animals.
We are. I do sometimes feel like a private investigator, especially when you get those horses that are incredibly obese, like they're like an 8 or a 9 out of 9, and they keep foundering, like they keep getting laminitis, and the owner's like, I don't know why, I don't feed them anything. They're fat on air, and you go hunting around and you're like, look at this green pasture that they're in.
Look at these horse treats from Tractor Supply, a big giant box of them. Yeah, it's always the owner, right? It's like in the murder mystery, it's the butler, but in the horse mystery, it's the owner.
Yeah, a lot of times, yeah.
We'll be right back with more Vet Candy.
Vet Candy makes learning fun with the most exciting experts on the planet. Become a Vet Candy member for exclusive access to our library of more than 100 studio qualities and race-approved videos taped in 4K. Say hello to streaming and goodbye to boring webinars with us. Plus, members can connect with specialists and licensed mental health care experts on our forums and get answers to your burning questions with our knowledge database. You can even create a custom learning plan, keep track of your progress, and track your CE credits all in one spot. Your personalized learning journey starts with us. What are you waiting for? Sign up today at myvetcandy.com.
I'm so glad to hear he turned out well, and it was such an interesting mystery. I love this. So I hope you guys in the audience, I hope you enjoyed listening to this, our first horse mystery. Hopefully not our last. This is really cool. So if someone wanted to connect with you, Dr. Genian, I know you're on LinkedIn. Is that the best place for them to connect with you?
I'm on everything. I'm on Instagram, Facebook, LinkedIn, and Twitter at Dr. Tan DVM.
You're on Twitter too? Okay, well, good. So you're everywhere. So if you guys want to connect with her, you definitely want to connect with her there. Are you guys doing any studies? Are you looking for samples from any horses anywhere else? Or are you working on anything right now that they can help you with?
I'm pretty good right now. I'm doing a lot of consultations. I'm actually going out this afternoon to go do a consultation. Yeah, no need right now, but we have this great distributed model at U of C where we have connections with all the partner clinics. So whatever we need, we can always chat with them.
Okay, great. So, well, thank you for listening. This has been Mysteries on Vet Candy. And if you like this show, you want to give us a thumbs up and share with your friends. So thanks for being on our show today, Dr. Jean Lynn.
Thank you very much for having me.
Vet Candy.
Vet Candy.
It's Vet Candy Radio.